invited, you can see your daughter.
Yeah, me too.
We ready to go? Okay. You've met Senator Conrad, Bob Kerrey, whose greatest distinction is he comes from Nebraska. Dave Walker, an economic patriot in literally and substantively, and Bob Rubin, great Secretary of Treasury. I always thought he was better than Alexander Hamilton, Kent. Do you agree that our fiscal outlook is unsustainable? And if so, what do you think would happen if we do nothing about our fiscal situation? Kent, do you want to take a shot at that?
Well, I'd be glad to. First of all, there's no question our fiscal situation is unsustainable. One of the people that came before the commission was a woman who has just studied fiscal crises in several hundred years of history. And interestingly enough, what she concluded is when a country reaches a gross debt of 90% of GDP, you can begin to see a pattern of a reduction in future economic growth. And the pattern is very clear, very persistent. And guess where our gross debt is today? We're at 92%. So, look, we have reached the danger zone. What is far more troubling is the trend line that we're on. As I indicated in my remarks, we're headed for a debt of 400% of the gross domestic product of the United States if we don't change course. And the consequences of that are reduced economic growth, the potential for a severe break in the value of our currency. And if that occurred, we would then be left with really awful choices. I remember very well having a luncheon here in New York with former Secretary Rubin, talking about the risks that are being run by this fiscal policy. And it just jumps out at you in looking at a historic context that we are on the cusp of real danger and real risk. So now is the time. We've got to face up to it, and we can. It's imperative that we do.
Do any of the rest of you want to take a shot at that?
Well, yeah, I mean, the problem is you have to interrupt something that's unsustainable before it's no longer sustainable. And I mean, Sam Rayburn was attributed to have said something quite important about American politics, which is in Washington there are two different kinds of people who can count and people who lose. And he wasn't referencing people who can count the deficit, but people who can count votes. And in this last election, the Republicans got a 21-point margin with people over the age of 65, in part by attacking a provision in the health care bill that reduced the increase of Medicare by $400 or $500 billion over a 10-year period. And the Republicans will be calculating how do we keep those votes, and Democrats will be calculating how to get them. And I remember way back in the 97, following the Entitlement Commission that you were on, Pete, we offered an amendment to the deficit final bill that balanced the budget to means test Medicare, which is fairly mild compared to what you now have to deal with. And we didn't get the votes. We got the votes in the Senate, but we couldn't get it in conference. When Senator Conrad says these are exceptionally difficult choices, what he's referencing is it's easy to fool the voters. It's very easy to fool the voters. And it's very easy to tell them they can solve the problem of waste, fraud, and abuse. It's very easy to tell them you can solve the problem by just growing the economy. It's very easy to persuade an audience that would prefer an easy answer, that there's an easy, pain-free choice to something that's going to cost them a little more or require them to take a little less in terms of benefits. So it's going to take a tremendous effort on the part of people who write checks in New York City, because this is the #1 city for political contributions, to say, we're not going to give to people who are dishonest when it comes to dealing with this problem. Otherwise, I think it's very difficult to interrupt this inevitable accumulation of additional debt.
All right, let me move on. Last week, the co-chairs of the Bipartisan Fiscal Commission, Erskine Bowles and Alan Simpson, announced their personal recommendations. I ask you a series of questions about their recommendations. Do you think they went too far or not far enough? What do you think about what they recommended? What do you like and what don't you like? Dave, I know you've spent a lot of time thinking about that.
First, let me apologize for my voice. First, I think it was very comprehensive. It was very constructive. I think it was a good first start. They demonstrated that everything had to be on the table. A bunch of controls, social insurance reforms, health care, defense, other discretionary, and taxes. They had a mix that was about 2 to 3 to 1 spending cuts to revenue increases, depending upon how you calculate it. They immediately incurred the wrath of the far left and portions of the far right, which probably means it's a pretty good proposal because the answer is in what I call the sensible center. And the difficulty is that after this last election, the sensible center is fewer in numbers than it was before. And so it's not just the issue of figuring out what needs to be done. It's the issue of how are we going to get it done, given the state of our current political system. And last thing I would say is whether or not Senator Conrad and his colleagues can achieve 14 out of 18 votes or not, I hope they can. But whether they can or they can't, in the final analysis, I think it really comes down to what is President Obama willing to embrace? What is he going to champion? And, you know, can he work and will the leadership work together with the president to make some progress in 2011? Because I think it's critically important.
Bob, how about you? Were you surprised or not surprised by and what did you think of the recommendations?
I thought the most important, I wasn't particularly surprised because I kind of was somewhat aware of what was going on, but I think the really important thing, and Ken, if you can get 14 votes, it's terrific. But my view, and this may be wrong, but my view is I think the most important thing is to put a marker out there that's serious, because I think it tells people that this campaign that's conducted 30,000 feet in the air, where Charlie Cook will tell you that 70 or 80% of the people are against deficits, but nobody wants to raise taxes or cut spending, isn't the reality of what we face. I think it's very dangerous, Pete. I'm an investor and I care enormously about what I have. And I think we're in terribly dangerous territory. And while the timing is unpredictable, it seems to me someplace in here, and it could be well out in time, but it also could be much closer in time, we could really have an implosion, not only in the currency, Ken, but in the bond market, and the two together. And you can see an awful lot, particularly amongst foreign investors, enormous nervousness about whether we have the political will. And you know, Paul Krugman keeps writing there's an intermediate term problem. It may be more probable in the intermediate term, but I don't think you can at all dismiss the risks in the shorter term.
Well, along these lines, how many of you think it will take a major crisis to get us to take significant action? And how many of you think we'll make major progress without a crisis? Ken, what do you? You're close to this.
Peter, I have felt, since the commission was named, after our initial meetings, people have asked me what I thought the probability of success was, and I've not said anything publicly, but I will tonight. I've really felt that it was a very low chance that we could get 14 of 18, maybe in the 5 or 10% range. Tonight, for the first time, I felt a glimmer of hope. Getting 14 of 18 is extraordinarily difficult, especially given the reaction of groups on the left and the right. Both of them have been, to me, completely irresponsible. Saying that you don't have to do anything with Social Security when Social Security is going to go permanently cash negative in 5 years. Permanently cash negative. And people say, well, You've got all these bonds. You've got assets. You've got trillions of dollars of assets. It's true, you do. Special purpose bonds that are sitting in a vault in West Virginia. Senator Byrd provided for that. He wanted to be his state's second billion-dollar industry, and he achieved that. You know, how do those bonds get redeemed? We had a long debate in the commission over this, David. You would have been, I think you would have been sorely amazed that we have to have a discussion about that question. And, you know, all of you know, the only way you redeem those bonds is out of current income. And when Social Security goes cash negative in 5 years, guess what? General fund's going to have to start providing subsidy to Social Security to meet those payments. And the crunch is really going to be on, because right now we're getting a tremendous subsidy from Social Security, about $200 billion a year. It's going to go away. So, look, I still think it's extraordinarily difficult to get 14 of 18. But today, for the first time, I felt that there is a seriousness of purpose in this group that could conceivably, with an act of God, get us to 14.
But Kent, even if you got 14 out of 18, what are the chances of then getting it through the House and Senate? Because you kind of have to do that too, don't you?
Thank you, Bob, for coming tonight. Yeah, well, that's the other big problem.
But Kent, that's where I come back to. Hopefully you can get 14 out of 18 on something. But realistically, don't you believe that even if you got 14 out of 18 on something, not a comprehensive package, but let's say Social Security, budget controls, a few important pieces that might be more ripe. I mean, from a practical standpoint, given what happened in the election in November, practically, isn't it something that's going to have to be dealt with next year, and the president's going to have to lead, and you know the leaders of both parties are going to have to come together in order to get something done?
No. No, you can ignore it as long as you want to. No, I mean,
No. What I'm saying is the idea that you could get something done in the lame duck Congress is not very
right.
realistic.
I think
That's what I'm saying.
what Simpson and Bowles laid down is beyond what's politically possible, but short of what's economically necessary. And you know, you talk about a crisis. I mean, I've spent a fair amount of time asking rich people for money in my life. I mean, that's what I do. I run a university. That's what 90% of my time. That's what I do for a living. In politics, you're on the phone asking people for contributions, and I can promise you there is a crisis in the moment when somebody says, "I'm not going to give any money to you." And I mean, I've attended lots of fundraisers in this election cycle in New York City, and I never heard a single person identify this as a problem that they intend to solve. And we got to quit writing checks to them. You got to quit writing checks to them. That's the crisis, Pete, that could lead to a solution. Until you create that crisis and you have it within your power. I love to see more young people here this evening than the gray hairs that are typically at this event. But we got to quit rewarding them with contributions. And what they'll say is, if I just get beyond this, I just got to get reelected. Once I get reelected, I'm going to do it. They say, that's baloney. You're going to say that perpetually. You know, so I mean, what Kent has already done by being on this, he puts himself at tremendous risk at reelection time. This is...
No.
Oh, geez.
It's not a problem.
Oh, my God. It's a huge problem.
Oh, it's a huge problem. Can I just tell you, honestly, I wish this weren't true, but I hate to conclude this, but I'm afraid Bob is largely right. If there's not a crisis...
Oh, my God, it's the first time you ever said that.
Well, I agreed with you 2 or 3 times when you were in the Senate.
I'm starting to palpitate here.
But, you know, there's something deep in human nature. You just don't want to face up to problems until you absolutely have to. And kicking this can down the road is the easiest thing to do. I tell you, when you've got the left and the right, you've got Grover Norquist saying anybody that votes for this is breaking their pledge not to vote for any new taxes. And on the left, you've got the whole litany of groups By the way, they're having an organizational meeting against the commission later this week in Washington, bringing in all the groups and saying that these guys want to shred Social Security because we are delaying or increasing the age of retirement by 1 year, 40 years from now. My God. You know, if you can't do that and increase it 2 years, 65 years from now, and yeah, no, we change the inflation adjuster and we go to 90% of the wage base, and you know, these things that we've all talked about for years, practical, common sense solutions, and they describe that as shredding Social Security when it's going to go cash negative in 5 years.
Well, by the way, increasing the
already
payments to
cash
lower
negative.
income people.
Yeah.
You make it.
Yeah.
And it's cash negative this year.
Yes, cash
And it'll be
negative
cash
now.
negative next year. And, well, the problem is the left doesn't have a plan. The right doesn't have a plan.
Well, but they do have a plan. They'll come into a primary and they'll defeat you, which is what happened in Arkansas. And the right comes into a primary, as they did in Utah, and defeats you. They threaten to run. That's their plan.
I'm talking about a plan that will avoid a crisis.
Yeah, but the
and
crisis
keep
is,
America
can I raise
great.
money and do I get reelected? And they'll create a crisis for you, David, in the primary. The left is threatening to do that on this issue, and the right's threatening to do the same thing. That's exactly what Senator
So
Conrad
does
said.
that mean that you
let me
need
push
political
you a little
reforms?
bit. There seems to be general agreement that it will take a crisis. Help me out. What might have triggered such a crisis? What does the crisis look like? Why is there a crisis?
You know, I just say the crisis could look like some morning the finance minister in China wakes up and says, you know, the dollar's going down in value. It's gone down 20% here. Why should we continue to be loaning them vast sums of money? I just think we won't show up at the Treasury window at the next auction. And they decide they're now our biggest creditors. And, you know, a few more decide to make the same kind of calculation, and we got a big problem.
By the way, can you explain to me, how does the Federal Reserve issue an IOU to buy an IOU? You guys are smarter than I am. How do they do that?
It's called self-dealing. The number 3 owner of our debt today is the Federal Reserve. And it's headed on track to be number 1 within 2 years. That might help us in the short term, but increases our risk over time. You cannot change market forces indefinitely. I think the bottom line is what's likely to happen, Pete, is we could have a crisis of confidence on behalf of foreign investors. They can't dump our debt, but they don't have to buy any new debt. And the fact of the matter is then all of a sudden you face a dramatic increase in interest rates. You face a dramatic decline in the dollar. We already have historically low interest rates. We're adding debt at record rates. Even without an increase in interest rates, the number 1 line item in the budget in 12 years is interest. The only thing we can pay in 2046 is interest, and that's without an increase in interest rates. So, I mean, we're living in a fantasy land.
Bob, what do you think might cause, what do you think a crisis would look like?
I think it's hard to know, Pete. You know, on October 19th, 1987, the stock market went down 22% in one day. Unexpected and dramatic thing. I've been around markets for a long, long time. It can happen, and you don't know where it's going to come from. You know, Ken, I think it'd be less likely to be the Chinese because they have kind of a mutual destructive. I think what scares me is that, although what you said certainly could happen, but the other possibility is that Singapore, Hong Kong, Malaysia, Thailand, a whole host of countries that own our debt can look at the Chinese and say the Chinese are stuck, but we're not. And they could not only stop buying, but could start selling. And then once you start to trigger an unraveling of the market, Pete, then it could go on the currency and the bond. And as I say, the probabilities are higher that it'll be further out in time, but I think the probabilities are material that it could be, though greater than the out in time, there's a material possibility it could be much, much sooner in time.
What do you make of Zellick's proposal to go back to gold and a lot of these commercial transactions getting denominated in gold?
I think it's the nearest whole number, I think, well, round off the nearest whole number, where 1 is sane and 100 is insane.
Yeah.
I think it's 100.
Oh, that's because you haven't been talking to me much.
Well, maybe 99, but But I also think this quantitative easing the Fed is doing is actually quite has a lot of risk, and I think that was and the world has reacted horrendously to it, and I think that was predictable. But even the advocates of this next phase, Pete, think that the benefit is relatively limited, and the risks, I think, are really quite substantial. You've got a debt ceiling problem coming up too, Kent, and I don't know how you're going to handle that, but that comes about, what, April, May or something?
First of all, Bob, I deny that I am in Washington.
You're in Washington.
I'm here in New York.
Unfortunately, that's not real world either.
Well, we got a big debt limit problem. Can you imagine in the House? when
That could trigger it.
It's gonna be
Come
interesting.
springtime.
Yeah.
Come springtime. And we've got to extend the debt limit. And there are members over there who are saying, who are going to be in the majority, that they will not vote to extend the debt limit, period.
I think realistically where you're probably likely to be is people are going to want something in exchange for increasing the debt limit. They're going to want tough statutory budget controls, or they're going to want something as a demonstrable act to say that we recognize something's got to be done. And those budget controls can be phased in based upon unemployment getting to a certain level, or, I mean, you know, we can correlate these things so we don't pull our legs out from under ourselves, but we've got to start doing something definitive. You know, Pete, there's already a signal. Who's buying our 30-year bonds? You know, we're selling debt, but we're selling short-term debt because people are concerned about what inflation is going to be. They're concerned about what the value of the dollar is going to be. And by the way, when you look at credit rating agencies, they're incredibly myopic. They're really looking at default risk. They're not looking at interest rate risk. They're not looking at what's the dollar going to be worth you're going to get repaid in. And if you're a foreign investor, you care about those things. You should.
Let me see if any of the rest of you share a concern that I have had. We tend, I think, Kent, to talk about this public debt as a percent of GDP as kind of a U.S. problem or a Greece problem or whatever. But I wrote a book not too many years ago called Gray Dawn. My great critic, Ted Sorensen, referred to it as the gray yawn. But in that book, I looked at demographic changes in the entire developed world. And what you find is that the trends are remarkably similar. The birth rates are down, people are living longer, they have entitlement programs, they don't fund them. So we started a major research project with the Peterson Institute in Washington. And we're asking them to project first what the global debt picture looks like. Not the US, but the global debt picture. And the preliminary indications are that almost every advanced country is in this 300 to 400% of the GDP. So contemplate the explosion in debt that's going to take place. And then ask yourself, what happens then? Is there a global debt bubble that bursts? And Bob, you follow these markets. To what extent are people or markets thinking about the global picture here?
I think, look, Kent said you met with Carmen Reinhardt. I assume that's who it was that you're
Yes.
referring to. And they've done this study, Reinhardt and Rogoff, Pete, which makes your point exactly. I don't know where it leads. You know, some people think it'll lead to monetization, and I think one of the things that was so dangerous about this quantitative easing too is that people connected the dots, and it reduced their confidence that the Fed wouldn't monetize ultimately. Pete, I don't know where it leads. I think it's very dangerous. I think you're exactly right. And it's throughout the developed world, pretty much.
But
We tried to look at the last time you had a simultaneous growth in the global debt. And this Carmen Reinhardt is the person we're using at the Institute. And she pointed out it was in the 20s and 30s with the explosion of wartime debt. And all hell broke loose at that point. All right, let me ask you a
But
question.
Pete, there's going to be somebody spending money on some other group of economists reaching a completely different conclusion. I think the central problem here is Medicare and Social Security are intergenerational programs. And what we've got in place right now is something that is, it's grossly inequitable. You've got to make a moral case here that it just isn't fair for the children of the baby boom generation to basically get hosed. That's what's going on. I mean, your ad captured it.
Yeah.
And unless you create a crisis for people who are calling people in New York wanting checks to be written by saying, no, I'm not going to do it. If you kick the can down the road, I am not going to write a check that enables you to get that done. You've got to create that crisis for the politician who's running for re-election, because if you don't, they'll continue to behave the same way they're doing.
People talk about, well, we can inflate our way out of this problem. You can't, because the problem's the off-balance sheet obligations, the tens of trillions of unfunded promises for Medicare, Social Security, et cetera, that grow faster than inflation and faster than the economy when the economy grows, because they're driven by demographics and rising healthcare costs. Candidly, we all know that entitlement programs are a big part of the problem, but they're not the only problem. There's a lot of waste in defense. There's a lot of waste in Homeland Security. There are a lot of outdated and ineffective discretionary spending programs. Our tax policy is non-competitive, too complex, and doesn't generate adequate revenue. Everything's got to be on the table. The U.S. government, to a great extent, is based upon conditions that existed in the United States and in the world in the 1950s. And we're going to have to engage in a fundamental review and reexamination to make it future-focused and more results-oriented. That's going to take time. But yeah, we need to reform entitlement programs and get control of healthcare costs that could bankrupt us. But we got to look beyond that, because
But David, I disagree with that. But it's an unbalanced proposition in the political environment, because what you hear, and I repeat it, I've been in lots of fundraisers in New York City where I hear people saying, we just got to get rid of waste, fraud, and abuse. You cut back on wasteful spending in the Department of Defense. I mean, I've heard that so many times, and it's satisfying to an audience who's uninformed with the facts. And the facts are, this year, Medicare and Social Security will go up probably $90 billion, increase, with no debate. And we're already shifting tremendous amounts of income from one generation to another. Sure. No wonder the 21% margin.
Kent, let me put a question to you. Everybody knows that healthcare costs increase are by far the biggest single problem. Your commission has gotten some criticism for not saying more about healthcare. Out of a certain amount of sympathy for your job, one of the things that concerns me is we don't know nearly as much as we need to know about how to reduce healthcare costs. I mean, it's easy to sit here and say, reduce them $500 billion, but the question is how? Am I correct or not that we need to know a lot more than we know right now about how to reduce the fee-for-payment system and the half a dozen of the other drivers? What is your sense of that?
After going through the healthcare debate, it's very clear we don't know enough. There are things we do know. We know that in Medicare, 5% of the beneficiaries use 50% of the money. Now, when I was going to business school, they told us to focus like a statistic, and a statistic like that with a laser. Who are the 5%? They're the chronically ill, people with multiple serious conditions. We do a non-existent job of coordinating their care. We did an experiment a couple of years ago, a pilot program with 20,000 patients, put a care coordinator on each one of them. Each one of them was chronically ill. First thing they did is go into the home, get out all the prescription drugs they were taking. I did this with my father-in-law in his final illness. What they found was, on average, they were taking 16 prescription drugs. After a review, they were able to cut it in half. I did the exact same thing with my father-in-law, and sure enough, he was taking 16. I get on the phone to the doctor, I go down the list. And I get to the third drug on the list. He said, well, Kent, he shouldn't have been taking that. He shouldn't have been taking that the last 3 years. You go a little further down the list, 2 drugs. He said, my God, he shouldn't be taking those 2 together. They work against each other. I said, well, Doc, how does this happen? He said, well, very simple. He's got a heart doctor. He's got a lung doctor. He's got an orthopedic surgeon. He's got me as his family practice doctor. He's getting drugs mail order. He's getting them at the beach. He's getting them at the corner pharmacy. He's getting them mail order. He's sick and confused. His wife's sick and confused, and we've got chaos. And I think all of you sitting here, if you think about your own families, know that that is pretty true. I also wanted to pick up, if I could, just for a moment on what David said, because defense, one thing that's been a revelation in the commission is what's happening in defense. 51% of the federal employees work for the Department of Defense. 51%. We asked them, that doesn't count the contractors. So I asked the analysts who were before us, so how many contractors are there at the Department of Defense? The answer is, we don't know. I said, well, can you give us a range? Yes, we can, Senator. The range would be between 1 and 9 million. That is the honest-to-God testimony before the commission. I tell you, we got a big problem here. They can't tell you how many contractors they've got, and the range is between 1 and 9 million.
But I'll posit for you the more difficult one. At least, I would say, in response to that, at least they're working. I mean, I lost a leg in Vietnam, right? So I'm classified 40% disabled as a consequence of that. The Department of Veteran Affairs just finally caught up and said, we got to do something about disabilities that are associated with Agent Orange, dioxin, that was used as a defoliant in Vietnam. So what do? Anybody who was in theater and has a list of these following diseases are eligible. So I get 40% right now. I could go down to the VA office because my father had coronary artery disease and I got elevated cholesterol, and I take Lipitor and get 80%. This is a new change that the VA made. And when Jim Webb stood up and said, I think it's a little too generous, the American Legion, the DAV, and the VFW, I'm a member of all three, so I got all these emails, call Jim Webb and tell him he's doing a terrible thing. I think it's like $10 billion a year to do this thing. So what I'm concerned about is that sort of thing. You know, that it's very difficult to say no to somebody who's hurting. It's very difficult to do it. And what I'm concerned about is not so much, I agree with you. I mean, the overseas bases can be cut back. There's a lot contracts can be cut back. But those in some ways are the easiest ones. The hardest ones are where you're just doing a transfer payment from one group of people to another.
Kent, it is my impression on your point about coordinating care that one of the bright spots in the healthcare thing are these integrated clinics where they're getting better outcomes and substantially lower costs. Is that correct?
Yeah, it's a thing that really shines through, Pete, in the analysis that was done as we worked through healthcare. These integrated care organizations are the shining light, whether it's Geisinger or Mayo, Kaiser, where you have teams of doctors sharing diagnostic expense, sharing administrative overhead, and having a team approach to patients. They're getting the best quality outcomes at dramatically lower cost.
And they're on salaries, as I understand it, in most cases. Is that right?
You know, usually that's the pattern. Doctors are on salary to the institutions. You know, one of the most interesting books I read as we were doing healthcare was T.R. Reid, The Healing of America. T.R. Reid, very excellent reporter for the Washington Post for many years, went around the world looking at different healthcare systems and comparing outcomes and comparing cost. And it was very interesting. What I concluded was the conclusion of his work. I won't attribute this to being his conclusion. The systems that worked the best in terms of outcomes and cost were Japan, France, Switzerland. In those cases, they all have universal coverage, but they have not-for-profit insurance, largely not-for-profit hospitals. And the government does not run the system. And they had cost half of ours,
And a budget.
global budget. They have cost about half of ours, and if you look at almost any quality metric, they're at least as good as ours, and I should include Germany as well. Those systems, not government run, there is a role for government in terms of helping those that can't otherwise afford it, but universal coverage, global budget, and not having the government run the system. These people are not government employees, they're private employees, the hospital administrators, the docs, the nurses.
To switch subjects, most developed countries, I think most, have a value-added tax, a consumption tax, or many do. And one of the cases for that is it helps increase savings, which is a national imperative. And yet in our Congress, I heard the vote was 80-something to some small number. Why is a VAT so much more difficult in this country than it is in other countries, Kent?
You know, part of it is because it's so easily dismissed as, you know, if you want to have a VAT, a value-added tax, or anything that's consumption-based, you're following the European model. And somehow that's, you know, that's not patriotic. It's interesting, you know, we have this professor, Gretz, that was at Yale, I think he's now at Columbia now, who had this plan to institute a system that would have a VAT that would replace the income tax for all those who have $100,000 or less of income. So you'd eliminate 100 million tax returns and have a 14 or 15% VAT. You know, interestingly enough, I don't think I'm breaking any confidence here, the top tax analysts that came before the commission all recommended a hybrid system, one that would have a consumption tax coupled with an income tax, but substantially lower rates on the income tax, and have a VAT or some consumption tax as a component.
Mm-hmm.
That's not the direction we're taking, clearly, but...
Right. One final question. We're going to have your report out in December. We're going to have the Domenici and Rivlin report out soon. Tomorrow. There are going to be other reports out. I'd like to ask each of you, what is your own prediction or prognosis of what's likely to happen in 2011 on this subject? Dave, you've got some thoughts on this.
Well, I'll tell you what I would like to happen in 2011. I'll tell you what I think will happen in 2011. What I would like to happen in 2011 is that probably in exchange for increasing the debt ceiling limit, that there are tough statutory budget controls that are put in place that eliminate the trillions of dollars of loopholes and pay-as-you-go, that have tough but realistic discretionary spending caps, that have automatic reconsideration triggers for mandatory spending and tax preferences, not automatic sequester, but reconsideration, that would help, that would kick in when certain triggers are hit, unemployment gets to a certain level in the case of discretionary spending caps, et cetera. And I would also like to see Social Security reform that makes it solvent, sustainable, secure, and more savings-oriented, strong base defined benefit, supplemental individual savings account on top. That's an add-on, not a carve-out. And in addition to that, some type of a transformation process, transformation task force to start rebaselining government over several years to bring it into the 21st century. What I think is most likely to happen is the budget controls as a trade-off for getting the debt ceiling to go up. But I think we need more than that because I think the clock is ticking and we could have a crisis before 2013 if we don't end up demonstrating some
Kent, what's your
efforts.
prediction?
You know, I don't want to predict because I don't want to be pessimistic. My 24 years in the Senate tell me to be pessimistic. I'm almost always overly optimistic because somewhere in my genetic makeup, and my dear, I think you've inherited this, I am optimistic that if there is a problem that is subject to rational solution, people will come to it. And I very much hope that's the case. I am very focused on trying to get a global deal. And by a global deal, I mean one that does deal with domestic spending, that does deal with the entitlements, that does deal with revenue, and to see the debt limit increase used as the lever to get it. I think we can create a crisis, and we can create a crisis around the debt limit. That's a very dangerous game to play. It's the only way we got this commission, by the way. A group of us said we would not vote for any more debt limit increases unless there was this commission put in place. So that's what I hope for, Pete.
Okay, anybody else want to?
Well, I just repeat what I said. I think unless you create an intermediary crisis and quit writing checks to people that aren't specific. I mean, the thing that Bowles and Simpson have done is move beyond the generic, the deficit's going up and we got to do something. You like vote for me and I'll okay, what are you going to do, Senator Blowhard? Are you going to tell me exactly what you're going to do? Which taxes are going to go up? Which programs get cut? Because unless you force them to be that specific by saying, I will not write you a check, it's a crisis, Pete. Mm-hmm. When you hang up the phone and your fundraiser said, what'd they say? And they said, hell no. Until you do something about this, I will not support you any longer. Until the funders start doing that, I dare to say, I think it's substantially less likely that anything specific is going to happen.
Okay, I'm looking at my watch. I would hope you would applaud me. And far more important, applaud our panel. Thank you so much.